Hi everyone. Today discussion is about community health assessment formula. My name is Sasi. I am a professor in ES College of Nursing. My department is community health nursing. At the end of the session, the student is able to explain tools of measurement, enlist the other measurements, narrate the expected weight calculation, enumerate degree of malnutrition, discuss the waist hip ratio, explain weight calculation. These are all the objectives we are going to discuss today. Introduction. As everybody know, community is nothing but the group of people living in a particular place in geographical area where they will be influencing one another to achieve the correct goal. This is what we used to say community. Now we are going to discuss about the community assessment. The community assessment is the collection and analysis of data related to the needs and characteristics of Head Start eligible children and families in the grantee service area. Example, geographical area, it identifies the program and community resources available to meet their needs and specifies where there are gaps. And community health assessment gives organizations comprehensive information about the community's current health status, needs and issues. In turn, this information can help with developing a community health improvement plan by justifying how and where resources should be allocated to best to meet community needs. So, here are some of the elements of assessment and planning frameworks. The first element is always organize and plan and engage the community. It is nothing but the community participation. Develop a goal or vision. Develop a goal or vision is nothing but what we are going to achieve at the end. And coming to the community health assessment, where we'll do all the assessment and prioritize the health issues. We happen to encounter a lot of issues in the community. As a community health nurse, as a personnel, we need to prioritize which health issues need to give first preference. Then coming to the develop community health improvement plan. Once we have identified all the plan, I have implemented a few things and we have to develop a community health improvement plan for the clients. In the sense, I mean to say the beneficiary or the community people, and implement and monitor community health improvement plan, and after that we need to evaluate the process and outcomes. This is what the few elements of assessment and planning framework. Coming to the classification of community assessment, here it has two types. One is community vital statistics measurement and another one is individual health measurement. By the way, we can assess the community. So now we are going to discuss about the individual health measurement. Here we have body mass index, expected weight calculation, degree of malnutrition, waist hip ratio, calorie requirement. And coming to the community vital statistics measurement, I know everybody knows what is vital statistics. It's nothing but the measurement of birth, death and marriage, divorce in the community is called as the vital statistics, and few components need to be assessed in the community. These components are, the first one is incidence rate and the prevalence rate, infant mortality rate, stillbirth, maternal mortality rate, net reproductive rate, couple production rate, the total fertility rate, disability adjusted life year, life expectancy, crude birth rate, and few more components also there. And coming to the vital statistics measurement, the first one is incidence rate. Incidence, this rate measures the annual incidence of a disease. I mean, the numerator of the rate is the number of times attacks of a certain disease are reported in a year, and the denominator is the population exposed to the disease during the same year. And note the rate can exceed 1 as there could be repeated attacks of the disease to the same person. Then coming to the incidence rate could be measured by number of new cases of specialized disease during a given time period divided by population at risk into 1,000. So the incidence rate could be measured by number of new cases of specialized disease during a given time period divided by population at risk multiply 1,000. So for example, if you take 1,000 cases was getting affected due to the particular disease, means that could be measured by 1,000 divided by population at risk. Population, if you take 10,000, 1,000 by 10,000 multiply 1,000. How much it comes? That is called as a incidence rate. Then coming to the prevalence rate. The prevalence rate could be measured by simple term new case plus old case at given point of time is called as the prevalence rate. This rate is the proportion of the number of people reported as having a disease at a specific point in time. The numerator is the number of people with the disease and the denominator is the total population. Now we are moving on to the infant mortality rate. It is the important vital statistics measurement. The infant mortality rate is IMR, otherwise called as IMR. They used to say in abbreviation IMR, infant mortality rate. 2 is an alternative to and in a sense an improvement upon the age specific death rate for age 0. Infant. Infant we can say for newborn it is 0 to 28 days is called as the newborn. When it's come above 28 days, 28 days to until 1 year is called as the infant. So any death happen in that particular after 28 days before 1 year is called as the infant mortality rate. The infant mortality rate could be calculated number of death happen before reaching 1 year, until 1 year divided by number of live birth multiply 1,000 is called as the infant mortality rate. So the infant mortality rate, how it could be measured by total number of death from 28 days to 1 year divided by number of live birth multiplied by 1,000 is called as the infant mortality rate. Okay, hope so everybody understood about this. Now we are moving on to the stillbirth. Stillbirth is the birth of a baby who has died any time from 20 weeks into the pregnancy through to the due date of birth. If the death was happened before 20 weeks pregnancy, it is called as a abortion. If it is happened after 20 weeks, then and through pregnancy through to the due date of birth is called as the stillbirth. Now we are moving on to the maternal mortality rate. This is MMR. It is maternal mortality rate. That could be measured by number of maternal deaths divided by number of live birth multiply 1,000. For example, the maternal mortality rate, in the maternal in the sense like in a particular, it starts from conception to after the delivery, until 42 days called as the maternal. So if anything happens in between that period is called as the maternal death. Like when the mother got conceived from the day to until the mother delivered the baby until 42 days called as the maternal period. So anything happen in between, anything happened to the mother, because of that mother was died, then it comes as a maternal death. So the MMR could be calculated by using this formula. For example, if 20 mothers was died due to some complication of pregnancy and number of live birth was 100, so the formula is like as I said 10 mothers, 10 divided by number of live birth is 100 in multiplied by 1,000, that gives the maternal mortality rate. The maternal mortality ratio can be calculated directly from data collected through vital registration systems, household surveys and other sources. Then coming to the crude death rate. Now we are going to discuss about the crude death rate. The crude death rate is calculated as the number of death in a given period divided by the population exposed to risk of death in that period. For human population, the period is usually 1 year, and if the population changes in size over the year, the division is taken as the population at the mid-year. So this is what crude death rate. Now we are moving on to the net reproductive rate. The net reproductive rate could be measured by the average number of offsprings that a female produces during her lifetime is called the net reproductive rate. If all females survive to the oldest possible age for that population, the net reproductive rate would be simply the sum of the average number of offsprings produced by females at each age. This is what net reproductive rate. Now we are moving on to the total fertility rate. In a lay term, we can say overall, in the overall women reproductive period, how many children she can reproduce is called as the total fertility rate. Fertility is nothing but how many children she can give. So total fertility, how many totally. Here the total fertility rate is in a specific year is defined as the total number of children that would be born to each woman if she were to live to the end of her childbearing years and give birth to children in alignment with the prevailing age specific fertility rates. This is what total fertility rate. Hope so everyone has understood this. And coming to the couple production rate, it is one of the important rate where for family planning service we could use this. So by seeing this we can promote the family planning method. The CPR is defined as the percentage of eligible couples effectively protected against childbirth by one or the other approved method of family planning, like sterilization. It is comes under the permanent method, either female sterilization or male sterilization, and intrauterine devices, condom or oral contraceptive pills if they use to protect themselves. I mean prevent from the pregnancy. So that is called as the couple production rate. And now we are moving to the disability adjusted life year. This is called as a DALY. They used to say DALY, D-A-L-Y, DALY. DALY is the sum of years of potential life loss due to premature death and the years of productive life loss due to disability compared to a standardized life expectancy. Then coming to the life expectancy. Life expectancy tells us the average number of years of a life a person who has attained a given age can expect to live. The sense the government of India and different countries has given how long the average one person has to live. That is what life we are expectancy. I mean what we are expecting to live the overall population. The sense each person has to live how many years. That is called life expectancy. Okay. Now we are discussing about the crude birth rate. Crude birth rate indicates the number of live births occurring during the year and per 1,000 population estimated at mid-year. That is called as the crude birth rate. The crude birth rate can be calculated by like number of live birth divided by estimated population multiplied by 1,000 comes under the crude birth rate. Hope so you have understood about the all vital parameters which we use to assess in the community. And still now we have discussed about the vital parameters which are assessed in the community. Now we are moving on to the other health measurements in the community. The first one is body mass index. This is the body mass index measurement has been done for the adult. Adult BMI could be checked by using this formula. The formula is weight in kg divided by height in meter square. By using this formula, we can find out the body mass index. And here I have given the reference from the net. Like they were saying 18 to 22.9 is normal, 23 to 24.9 is overweight, and 25 to 29.9 class 1 obese, and 30 to 34.9 class 2 obese, more than 35 class 3 obese. Here they have given some formula like this. But few more formulas also available in the net. We can say that they were indicated, especially in Indian formula. 18 to 24.9 is the normal. If their BMI is 18 to 24, I mean 18.5 to 24.9. 18.5 to 24.9, it is the normal BMI, and when they go 24 to 29.9, they'll comes under the overweight. Then if it goes 30 to 35, it is the class 1 obese, above 35 to 40 class 2 obese, and above 40 it is a class 3 obese. This is also one of the formula, I mean BMI calculation, which is available in the net also. So usually as an Indian, we can refer like 18.5 to 24.9 is the normal BMI. If we weigh in this range, we are normal. If it goes beyond the level, either we'll go with overweight or obese, and if it goes below like 18.5, it is a undernourished. So by the way, the body mass index will be measured. Yes, this is what the range they have given here. And for example, body mass index, the weight is 56 and height is 165. This is what the example I have given. So when we measure this 1.65 into 1.65, then it comes 56 divided by 2.72. Then it comes 20.5. It is a normal BMI. As I said, 20.5 is a normal BMI. Okay. Next, still previously we have discussed about the adult. If you want to calculate the BMI, we use the formula to calculate the BMI, or for adult we have used that. Now we are moving on to the expected weight calculation for the children's. Children's means when the baby was born, as we all know, the baby weight has to be 2.5 kg, it should be not below that, and 3.5 until 3.5 it is acceptable one. The baby can weigh 2.5 to 3.5, but this is for the first 28 days. When the baby was born, first 10 days, the 10% the weight will be reduced. Then after 10 days, the weight will be start to pick up. This is what the normal baby weight. And when the baby reach to 3 to 12 months, I mean when the baby goes 3 to 12 months, there is a formula which is available to calculate the expected weight. This is the formula 3 to 12 months, where we will be using the age in month plus 9 whole divided by 2 for the baby age of 3 to 12 months. When the babies reach 1 year, so where we will be using the formula of 1 to 6 years, age in years into 2 plus 8. Then coming to the 7 to 12 years, age in years into 7 minus 5 whole divided by 2. Then if the baby, I mean the children goes above 13 years means, where we'll use until 12 years we will call it as a where we'll call it as a children's, I mean school going, we will call it as a school going, and after 12 years, I mean 13 years, they become a adolescent. When they become a adolescent, where we'll use as usual BMI calculation. Okay, so above 13 years, so if you want to calculate the baby weight, where we can use height in centimeter minus 100. This is the calculation where we can use to find out the ideal weight, expected weight of the children, like not your children, they are adolescents. For example, when one adolescent is height is 160. So how much weight the adolescent should have? Any guesses? Yes. If their height is 160, height in centimeter, I told you the calculation here, right? 160 minus 100. So the adolescent has to weigh 60 kg. Yes. Right? So this is the formula where we can use here. So now we are moving on to the next slide. I have quoted some example over here because I already said, I mean the baby born until 28 days, how much weight the baby has to have. Then where we will be checking about the head circumference and chest circumference, and for the baby, if it's a newborn baby, 0 to 28 days, the head, I mean when the baby was born, the head should be lower than the, I mean the chest should be, I mean the chest and head has some differences when the baby was born. And the birth weight, already I told, the length of the baby is ideally it is, I mean 48 to 50 centimeter length will be there. And in the year of 1 year, the height of the, I mean sorry, the head circumference as well as the chest circumference will be equal. After the 1 year, the chest circumference will be overtaking the head circumference. So this is what the newborn assessment where we will be doing. Then coming to the 1 to 3 years, as already I said, previously I said, if the baby, I mean if it is an infant, I said age in month plus 9 whole divided by 2. When they come to the 1 to 3 years, here we are using age in years into 2 plus 8. For example, if a baby is 3 years old, so where you are using the age in years into 2 plus 8. Already I have given The baby is 3 years old. So 3 into 2 plus 8, it comes 14 kg. So the baby, we are expecting the weight of the 3 years old baby is 14 kg. Hope you have understood about this. Then coming to the formula for 6 to 12 years. Here we are using the age in years into 7 minus 5 whole divided by 2. The whole was missed over there. Age in years into 7 minus 5 whole divided by 2. Here the child is 6 years old. 6 into 7 minus 5 whole divided by 2. So it comes 18.5 kg. Right? Hope so you understood about this formula. If you want to go through, if you want to have any other clarification, you previously go back and see the formulas, right? And coming to the degree of malnutrition. The degree of malnutrition could be calculated by actual weight divided by expected weight into multiply 100. So already I said, you know what is actual weight? The how much the baby is weighing is called as the actual weight. What is expected weight? The baby, how much the baby has to weigh. Has to weigh is called as the expected weight. You just measure the baby, how much it comes, it is actual weight. Then we are how much the baby has to weigh according to the age is called as the expected weight. When you are multiplying by 100, then we'll get some kind of values. If it is comes 90 to 110, it is a normal. 75 to 89, it is a mild malnutrition, that is first degree malnutrition. And 61 to 74, and it comes under the moderate malnutrition, second degree. Under 60, it is a severe malnutrition, third degree malnutrition. Hope so you have understood about this. Okay. And here I have given some example for degree of malnutrition calculation. Actual weight divided by expected weight in 100. Actual weight is 12 kg. Expected weight is 14 kg. So actual weight is how much it is? 12 divided by 14 multiply by 100. Then it comes 86%. The babies comes under the mild malnutrition. Now we are moving on to the waist hip ratio. It is the perfect measurement of measuring the central obesity. It is nothing but the some people will have the obesity in the abdomen. So it is called as a central obesity, where we'll use this waist hip ratio. By the way, we can measure the central obesity. So the formula is waist circumference divided by hip circumference. Waist circumference, it is how to measure the waist circumference. Here I have given how to measure it. Stand and place a tape measures around your middle just above hip bones. You see the picture waist measurement how they have did. And coming to the hip circumference, circumference of the widest part of the buttocks. Yes, it is the widest part of the buttocks was taken. So the waist and hips, how much it waist and hip ratio would be calculated by this way. For inference, as an inference, female if they go greater than 0.85, it is obesity. Male if they go 0.95, it is a obesity according to the WHO calculation, right? Now we are move on to the calorie requirement calculation. So it is also one of the important component where we can do it in the community. Here we have a 3 components. One is weight reducing diet. The people want to reduce their weight, they can take 20 kilocalorie per kg body weight. They want to maintain their, like the people who are in the normal BMI, they want to maintain their diet, they can take 25 to 30 kilocalorie per kg body weight. When they want to increase their diet, weight, so they have to maintain the weight increasing diet like 35 kilocalorie per kg body weight. This will be applicable to the undernourished, the people who goes below 18.5 BMI, right? Okay. So we'll see some of the example. Weight reducing diet. If they want weight reducing diet, like the person weight 85, height 155 centimeter. So if they want to reduce their weight, as I already told, if it is adult, they have to minus height minus weight. 155 minus 85 means how much it comes. Likewise, they have to do it. It is 155 minus 100. How much it comes? They have to weigh 55 only. I mean to say the height is 155 centimeter. How much weight the person should have means only 55 kg alone. But the person is weighing 85. So he has to go ahead with the weight reducing diet. 85 into 20 kilocalorie, 1700 kilocalorie he has to take per day. Then coming to the weight maintaining diet. Here they have given weight is 65, height is 168. Yes, it's okay when the person is like weighing 65, when he is having height of 168, it is okay. So here where he can take 65 into 30 kilocalorie, 1950 kilocalorie per day he can able to take. As we all know, 2225 kilocalories is the normal person can take per day as a woman. Okay, when we are moving on to the weight increasing diet. When they want to increase the weight, they have to take 35 kilocalorie per kg body weight. When the person weight 35, height 145 centimeter, I hope everybody knows the person has to weigh 45, but he is weighing only 35. So he can take 35 into 35 kilocalorie. I mean 35 is the weight, and he has to take 35 kilocalorie per kg body weight. So at least he has to take 1225 kilocalorie has to take per day. Okay, so increasing the diet, because all of a sudden we should not increase. According to the weight only we need to reduce, we need to increase. We should not completely take high kilocalorie and low kilocalorie. So it is a minimal, at least they should take at least 1500 kilocalorie. Below that they should not take, right? This is what the calorie requirement calculation. And I hope so you have all understood about the what is community assessment, what are the tool can be used to assess the community issues. By the way, two process I have given there. One is vital statistics, another one is other measurements. Hope so everybody have understood about the how to do the assessment in the community. So here I am concluding my topic. Community assessment tool can be used by countries to rapidly assess and respond to community health needs and perception around access and effective use of essential health services. Assessments are performed prior to taking action and are used to determine current situation and identify the issues for action. Need assessment establish the essential foundation for vital planning. So everybody have understood about the concept. I have taken the content from the Park book. Few contents I have taken from the net also. Thank you. Hope so you have understood about the topic. Thank you so much once again. Thank you all.